Assalamu alaikum wa rahmatullah. My name is Marwan Abdulaziz. For those who don't know me, I look after Dubai Science Park and recently Dubai Academic City and Dubai Knowledge Park. So if you haven't seen me lately, I've been moving around those three sites. But it's exciting, I think, the intersection between science and education and research, especially. So many things going on, so many more students coming to the UAE and particularly to Dubai. This year has been probably the intake of September was one of the biggest intakes of international students that Dubai has ever had. And the number of international students accounted for 50%. And usually it was about 30, 25 to 30. And there are big plans to grow that as well. The Dubai 2033 plans account for an increase in number of students from today's 50,000 to 100,000. So that definitely will have an impact on the industries, whether it's technology, healthcare, and others. In addition to the new R&D grant system that was launched a few weeks ago, so now universities will have access to grants and that will allow them to do research. So much more collaboration between industry and academia, and this is something that I'm very, very excited about, and I think there will be a lot coming out of it. In today's event, we want to dig a bit deeper into technology aspect on healthcare specifically and how technology can help healthcare. Can it cannibalize healthcare? As we know, the traditional healthcare is based on the number of surgeries that you do, the number of patients that you see, how much vitamins you can sell if you're a pharmacy, for example. But technology is really on the other end, is not for you not to do surgeries, not to see patients in the hospital. So how is that helping the healthcare system, or is it not helping? And also the introduction of AI, whether it's preventative medicine, whether it is looking at lifestyle diseases, for example. How is AI helping us to know healthcare and know what's coming? Again, in a way that will support the growth of the sector instead of cannibalizing the sector. And with that, I have a great panel of speakers today that will help me unlock that mystery. We will start with Omar. He is the Chief Facility Planning and Expansion Officer of the American Hospital in Dubai. As you all know, the American Hospital has taken over one of the hospitals that we had here in Dubai Science Park and will be very, very soon operational. And we're very, looking forward to that. So, Amr, the floor is yours. Thank you.
Thank you all so much. It's an honor. And I think Mr. Marwan paved the way for me to speak about the general healthcare ecosystem. And then also I want to talk about the advancement in AI, cost and benefit, and how we all need to work together, patients, decision makers, and regulators to streamline that. We are basically a combination of healthcare service providers, regulators, medical device companies, and insurance entities or insurance companies that subsidize that. All geared on focus to personalize the patient journey and make it so smooth and positive experience for a good outcome. When we started talking about healthcare years ago, we can feel the advancement in healthcare. First, we can see the old stethoscope and then the not so old stethoscope. This one, you have to put it on your ears. You have to listen to the heartbeat. That one, you can do both. On your ears, off your ears, you can see the ECG chart right on the display. Electronic medical records in the past had to be manually charted. You had to basically get the strip of the ECG recorder. You had to scan it, print it, attach it. Now it's all in the hands of the physician. Doctors walk around and they can view images, they can see ECG strip charts, they can even see lab results that just came off from the specimen. And we can see the difference between the nurse call before and after. And I was talking to Fatin about the patient journey and enhancing that. And I told her that we will have shared slides, I'm sorry. Nurses before had to shout to get help. And now what they do is simply push a button to escalate the level of urgency. They basically can wear a lapel or a device, we call it Vocera, and that talks to a group of nurses, which we call it, let's say, a code blue group. They can activate a code just by pushing a button. The nurse call is now an informatic system, which means it gives you everything that you need. Not only your TV, but it shows you your meds, your next meal, and your next meal is custom tailored for you if you're a diabetic patient. We've seen the journey before and after with medical imaging, where we had the fluorescent light boxes, and now you have 2 megapixel to 5 megapixel Barco-Bar stations. When you had a dental issue before, you had to go to the dentist, and then they will put a crown. Sometimes the crown is not level, where you feel the bite, like you bite on a piece of sand or rock. Now it's all done by a scanner. So you scan all of your set of teeth up and down, and then the CAM-CAD gives you a printed, 3D printed image of what is required, and it's perfect every time. So AI in healthcare, and when do we have AI in healthcare? As we see, we've done AI in healthcare based on our experience from civil applications. One of them is when the pilot and the co-pilot get so much in trouble in hard weather conditions, they engage what we call as autopilot. And autopilot measures the altitude, the distance, the turbulence, the pressure, and then the distance from the runway, ultimately landing the airplane much safer than the pilot and the co-pilot. We do it in the Google every day. We have it now as wearables, and the wearables gives you how many steps, your pulse, your SpO2. So AI is just a combination of hardware, software, and algorithm that is custom tailored to serve us, getting into an application for a combination of services. We're talking about cancer diagnosis, we're talking about imaging, detections, genomics, pathology. Why is it so critical? Because it's huge in terms of the database, and it's very fast in terms of analyzing data. Watson was introduced, and Watson was shown to show accurate results and detection for cancer, much better than 30% of the cases in terms of oncologists. So we use AI in discovering cancer, in genetics or genomes. We do that in pathology, where we take a slide and then AI would basically circle and identify that there is or there is not, and it predicts it to cancer protein formation. We have vast amount of applications also for AI. One of them is detection of osteoporosis, and this is post-MR images, and it shows a signal of strain and stress on the cartilage, and that red area highlighted by AI shows that this patient may have osteoporosis, but 3 years earlier, which helps us prevent it. And the same thing with melanomas. When we are out in the sun and you get a freckle that you suspect, you go to your dermatologist, they do analysis, and it shows AI can show you if it's malignant or benign. This is a retinal detection system that shows you the condition of the retina, if you have diabetes or if you have any damage to the retina. And I'm starting from the head down, and I'm going to go on a nice constant pace to get my other colleagues time to speak. We did from this is head up, stroke and dementia detection, and then as a radiologist, the radiologist would see the image on the left, and the image on the right is the predictive map that allows him to compare the previous and current images. Brain hemorrhages, it's not so visible on the left, and you can see what AI did, suggestive again, and then the physician would say yes or no. It's all up to the physician. This is a brain aneurysm, which is basically an enlargement of vessels and capillaries in the brain. We use the AI also for detection of microcalcification, which is an early sign or tracer for breast cancer. And again, AI would just give you the box or the pixel, and then you may decide to say, no, that's okay, or I want to get a biopsy from that lesion. This is a liver metastasis, and I zoomed in all of my images to show you that it's really a challenge to get a correct diagnosis for these conditions. This is a liver metastasis, late stage, and you can see that AI circled it. It's really hard to tell from the image on the left. Aortic aneurysm, based on the size of the aorta in that slides. Lung nodules, and it's very clear and defined. However, a normal physician may have a challenge with it. This is a pneumothorax or collapsed lung. COVID-19 inflammation in the lungs. Endoscopic images where you can see the top left, you have a polyp that is well defined, and then you have inflammation in mucosa, and then AI would, in the slides on the left, would show you where the polyp is, and it shows you where the inflammation in the mucosa is, so you can compare the top and the bottom images, and then you'd notice how helpful this software is. And in general, and I'm going to stop here for a minute, what we see is, what if we don't catch that? What if we don't detect that? What happens to the patient? What happens to his journey? What happens to his treatment plan? What happens to surgeries, repeated surgeries, biopsies, repeated biopsies? So here's again a polyp in the colon. This is a hard-to-see lesion that AI caught. And now we're looking at all of these shiny images in bright orange. We inject patients with tracers, whether it's FDG, which is fluorodeoxyglucose, it's radioactive sugar with low activity, and then the sugar is uptaken by cancerous lesion on a higher amount than the conventional tissue. So you can see in the liver there are lesions because of the uptake, which tells the doctor that there is a suspicious cancerous lesion. The technology and future is always evolving. Prior to the introduction of the breast CT, we were doing mammography with compression. And then sometimes you have to do compression and you have to do other tests, including biopsy, to make sure that you're getting the lesion and the proper scan for the breast, including the lesions along the chest wall. With the CT, you get the same dose exposure, no compression, especially for dense breast, with perfect outcome. This is the old linear accelerators, and it was a C-type gantry that rotates around the patient, big, bulky, and you have onboard images, which is on the right and the left. It looks scary, even though I put in a 6-meter sea viewer and made the ambience as beautiful as I can. But this is what it looks like now. It's a simple CT gantry, and it basically gets the image of the anatomy and then irradiates simultaneously. And this is the next step forward, which is at our American Hospital Science Park, we call it a cyber knife, which is a device that works robotically around the anatomy, irradiating with high precision doses and best outcome. Last is, this is the Zapex, which is a self-shielded gantry that this is focused for the head and neck cancer. And this would allow us to irradiate at a pencil beam, 1 mm beam, which spares us from getting the patient blind if he has a lesion close to the optic nerve, or let's say deformation in the general hormonal secretion in the body if the patient has a tumor next to the pituitary gland. And one of the progressive technologies and one of the innovative technologies, and I see that this is going to be the future, is something called histotripsy, which is an ultrasound head that you place over the prostate, liver, kidney. And what it does, it shows you the anatomy, and then it allows you to ultrasound with the ultrasound energy to basically fragment that lesion, kill the cancer, leave it there, no surgery, no cutting, no dissection, and then your system would absorb that fractionated tissue. Of course, we all know what the robots and the robotic system does, and I will just highlight how smart this system is with the AI. The difference between a robo and a very skilled, experienced doctor, I will list it in, let's say, 5 advantages. One is the doctor cannot do this in 360. Well, the robo can. Second is the doctor, when he stitches, he doesn't know how hard to pull. Well, the robo does. If it's a tendon, he'll pull hard. If it's an epithelial tissue, he will not pull hard. Third is cutting. The doctor, when he's sitting laparoscopically, he doesn't see the anatomy. He would not know which scissor and how hard to cut. The robo knows that this is not something that you can cut. With this, you have to ablate. And last is the robo allows you to zoom in so close to the targeted anatomy. It gives you a better look. This is a system that was introduced for spinal navigation and robotic spinal or spinal fusion. And it targets the pedicles with high precision. When we talk about precision, I'll share with you some slides of the actual pedicle and the metal. The high contrast bracket is the pedicle nails and the pedicle brackets. And what it does is identifies the required nail and required depth without actually taking axial and lateral images and exposing the patient to radiation. You just take one image and you plan accordingly. When it's cranial, it tells you what's the safest point to enter to avoid critical anatomy. And when it's a pedicle on the spine, it shows you before a pedicle nail insertion what is the proper nail length and outer diameter. So you don't have to do repeat, re-cementing of bones, and you'll have a perfect outcome from the first time. For prostate, this is what AI allows you to do. It is so hard to visualize the actual cancerous areas in the prostate. This permits you to do partial prostate treatment. Now you can see the difference. It's almost near impossible to detect without. And now with prostate, what we do is we can do partial ablation for the prostate lesion using ultrasound, which we call it a HIFU system. It basically precisely locates where the lesion is and then ablates it. Thank you so much.
I'm Nick Dillon. I'm here to talk about, as you see, advancing healthcare technology in the healthcare ecosystem. A bit about myself. So I'm currently Chief Operating Officer of Smart Salem. So we are a PPP with the government. We have 3 clinics around Dubai. We focus on a lot of government medicals, visa medical services, as well as predictive and proactive healthcare for the private sector and occupational health. However, much to my marketing manager's distaste, I'm not here to talk about that today. For the previous 20 years of my life, I focused on providing healthcare to some of the most remote parts on the planet. I'm a paramedic by trade, advanced practitioner, postgraduate in emergency medicine, critical care and flight medicine. It's my job, it used to be my job before I started wearing nicer clothes, to go around the world and help people. So be it private sector, oil and gas, rigs, exploration, adventure TV shows, the United Nations, NATO, militaries and governments. Whenever they found themselves in remote places or needed assistance in developing systems and processes to help those that found themselves there in austere environments without necessarily the great trimmings that we have here in healthcare, it's my job to either provide care or provide solutions to them. So I'm taking the ecosystem as these areas, which might be slightly different, and I'm nowhere as learned as my fellow speakers about the Dubai system, but I'm going to take this aspect of it. So to say the majority of my career has been spent aimed at providing good medicine in bad and difficult and hard to reach places. And since I've been places and done some stuff, I've actually often been asked to comment about future technology and particularly being within the critical care world. I've been at the pinnacle on the one hand using the most high-tech devices, working within critical care transport of all of the latest technologies, but also trying to apply it in places where there was nothing. You couldn't even get power. So I've always had to try and make that balance. So on the one hand, I've appreciated the massive innovations that have been going on, but also seeing the realities on the ground. And as such, I've often been asked to comment on how we can apply healthcare, how we can harness healthcare to these difficult environments and these environments. And whenever I have, I've often reverted to Confucius and his saying here, to study the past, you would define the future. I fundamentally believe there's a lot to learn by building the shoulders of our ancestors. There's nothing particularly new in what we do day to day. Throughout human experience, we can learn from similar situations. And that's an issue I'd like to start today. I'd like you to take you back to a time in history where there was similar amounts of innovation, when there was massive private and public sector investment, when we were really looking to sort of develop new areas of human endeavor and creation that was all backed by technology. So I'd like you to take back to the 1500s in Europe. Feel free to give yourself some titles, lords and ladies, perhaps some ruffly collars or something like that. Imagine yourself in an Admiralty interview board or something like that in those days. This period in time saw massive technological revolutions and innovation. Huge amount of innovation was going in at the main industry of that period in time, which was shipbuilding. The development of the clinker system of hull development were enabled to make ships bigger, stronger, faster, carry more. And this was driving industry at that point in period in time. That was also associated with concurrent development of enablers, much like we see today. So sail making, foodstuffs, navigation, discovery of the trade winds was coinciding with technological development. In addition to that, there was huge both public and private sector investment in driving this forward. So from the royal families of the old Spanish galleons to sort of private investors looking at trade, everyone was harnessing technology and harnessing innovation to progress and to develop. This all came to fruition in 1492. Columbus sailed the ocean blue, anyone who went to school in those days, and it enabled Christopher Columbus to cross and to close the Columbian Gap. Now, I note I didn't say discover America, because what happened was we probably worked out that someone was there beforehand. However, because of that technological innovation, it enabled to close the gap between the New World and the Old World. So, imagine 1500s, Columbus is got into America. We now have consistent trade routes that's driven by technology. Innovation is going on. Similar crowd of people yourselves, innovators, investors, people trying to enhance society. Where would you imagine the greatest gain, the greatest harnessing of this for human endeavor will come from? Would it be the discovery of gold, new technologies, bullion? Where would you think that you would put your money in? Now, I don't think I would do you a disservice if none of you mentioned the humble potato. Now, you look at me and go, yeah, right. The potato fundamentally altered Europe from that point onwards. All the technological innovation that occurred at that time was culminated in the discovery of a dirty little thing that dug out of the ground. Why? Because it solved the problem that 98% of the population had at that time, which was food security. The potato enabled the everyday person, the 98%, to actually have a high-calorie unit of food. Not only that, it actually was scalable within the current ecosystem. It was scalable with what they had at that point in time, which is basically an empty field. It was scalable within the technology that was there and the training of that time. It was also highly efficient. So instead of having to plant seeds, because it was a tuber, but you were able to just take one potato, take little bits offside it, plant them, you got a load more potatoes. Brilliant. The crop cycle was far quicker than the corn growing at that time. You go, okay, potatoes, generally good. I'm from Ireland. I've got a natural passion for potatoes in that side of the world, but it can't be that good. This is a population graph of European population growth at that point in time. As you see, post-potato discovery, and by the time that deals out. Now, I challenge any of you to find a healthcare innovation that can impact a population curve as much as the humble potato. So let's keep ourselves honest when we're looking at innovations and the impacts of it. Judge yourself against the potato. So what? Great, nice story, but how does that apply to this particular point in time? Firstly, what we can learn is the combination of investment and development works. Innovation with investment and enablers does produce massive results throughout the world. For big effect, look at the problem of the 98%. A lot of what we do, I find, in healthcare is we're dialing in to allow that 1% to get a 1% attitude. Now, it's a simple fact that I have solved a core fundamental problem of the 98%. I've reduced a major barrier that everybody was having. I will have the greatest effect. Look at the third or fourth order consequence. So, was it the shipbuilding that solved it? No. Was it sail making? Was it investment? No. It was down the line. The high-tech solutions enabled a low-tech impact. So when we're looking at our healthcare and how we harness healthcare, it has to take us somewhere. It has to take us somewhere that we maybe not even understand or know. But the actual development of technology should not be seen as the aim in its own right. To truly harness it, it has to take us in a direction, and we have to be open to where we can put it in. And finally, simple solutions to major problems create big results. And they are the core learnings, I think, that we can take from this previous period. Now, if we transition to our current ecosystem, so it's complex, much the same complexity as we saw back then. Healthcare ecosystem, as a learned friend has told us, complex. We have patients, investors, pharmaceutical agencies, huge amount of stakeholders that are varied. We have massive public sector investment and private sector investment going in. We also have huge tech enablers coming in. The internet in its own right, allowing rapid communication and data sharing. Artificial intelligence, as we've seen, is really changing how we're using data and complex information, that we can really manipulate that far, far quicker and far more accurately than we could beforehand. Fiber optic communications can be paired with robotics, such as this Da Vinci system, where we can actually have remote robot-assisted surgical interventions. And then we have nanotech and genomics that are trying to get ahead of the curve. So how can we do predictive healthcare? How can we treat before it happens? And then AR and VR. So they have broad applications across both healthcare and the education, delivery, and patient journeys across the way. So we have a huge amount of enablers combined with huge innovation and investment. So the ecosystem is there. But where can health tech make the most impact? This is a question we should be asking ourselves when we're trying to harness ourselves. How can we impact the 98%? If we're going to harness health technology, How can we make the biggest impact? What barriers exist to the everyday person? What barriers exist out there that we can solve with technology? Where is our potato? Where can we actually find that single dirty little bit that we've kicked up at the end of our journey that will make a population curve change? A bit more about the sort of context of my ecosystem. So, Tanzania, 2016, I was asked to go in. It's a big regional hospital, massive, comparable in size to anything we have in Dubai, serving an even larger population group of otherwise underserved sort of individuals. Just timelines for these people to get to hospital. They had to camp 3 days outside the hospital to get in and journey for many more to get there. The concept was that the very nice people wanted to put a $10 million ICU facility in. Now, I'd imagine everyone knows what that is. It's lots of machines that go ping and beep and shiny things. When I got there, so I had to go in there and kick the tires and see if this was a good idea and how would make that happen. When I arrived there, out of the entire facility, very, very educated doctors, brilliant healthcare professionals, passionate, making huge differences to everyday lives. Only one doctor was trained to read an ECG. Now, that would be a common skill set for sort of nursing stuff with our current environment. And none of them were trained on ventilators. So despite the fact that they was willing and able to put in technology, $10 million worth of technology that we thought would fundamentally change the outlook and survival rates of post-operative care for this area, it just wouldn't work. Now, why weren't they there? When I asked them, I said, look, what's the problem? Why haven't you done it? What's going on? They're smart individuals. I said, well, there's a traditional book that you read when you go through sort of med classes, and it's so the ECG Made Easy. Some of you might have read it, so it's a classic one. And they said, but Nick, no one has ever translated the book into Swahili. So we've got technology there willing to be implemented. We've got very, very educated individuals there who want to initiate it. We've got a population that needs it, but the barrier is simply no one had translated the book. And they told me, said, Nick, for us to go to med school here, I have to learn a foreign language first. So how is that barrier still existing? How can tech help this ecosystem? And this is, imagine if we solve that problem, suddenly we can uplift everything. That's a 98% problem. And this is where I think we need to, when we're looking at how we can harness health technology to really help the place, how we can get the most out of it, we really have to focus on identifying the needs within the ecosystem. Look for those barriers and try and annihilate them. And this is where technology has a huge impact, because it's relatively easy to do. There's low-lying fruit. For me, core areas we need to look at: education and prevention. So I was in Iraq. Should I go to Iraq? And so I implemented training programs for non-medical practitioners. So I trained a load of people on advanced cardiac life support. Suddenly we uplifted the entire clinic, so everyone became an advanced cardiac life provider. The problems I faced was that on the actual devices, they knew what to do, they'd read the books, they're willing, ready, and able, they knew their exams, but they couldn't read the squiggly lines. That was the barrier. So in order to get them to pass, I had to end up putting post-it notes over the lines so they could learn them. So again, it's a technology problem, not a person problem. Education, I believe, is a core aspect. By getting more clinical practitioners and more clinical staff in the world, we can make the difference. If we look at where the highest mortality rates, and we overlay that with where there's the least clinicians or medical professionals per capita, it correlates. Simple as that. Health tech in education, I think, is not underserved, but I think it's underweighted in what we can do. By developing health professionals, I don't need power. I don't need a battery. I know out here we're talking about AI as our own independent source. But there's nothing wrong with having a doctor where there's no power. How you don't have to charge him, he doesn't break down, you don't need spare parts, you don't need internet, he's quite low to maintain. So they're quite useful. People are generally quite useful. If we can train a load of them, just get them out there and start doing doctor stuff. Brilliant. Education and translations. Simply by translating medical literature and allowing people to read it in a platform. Simple sort of stuff, but that would solve a 98% problem. AI-assisted learning. So within our current healthcare education programs, you need to be a high achiever. There's barriers there. If I'm a little girl, absolutely whip it smart, but I'm sitting in a little hut somewhere in central Tanzania, there is no pathway for me to become a doctor. Simple as that, because the prior learning required and the actual exposure to that learning does not exist for me. AI can change that. You can have your own personalized tutor to sit on your shoulder through med school. It can be remote. We can leverage our existing technologies, communication networks, and suddenly we open up a world of opportunity and solve that 98%. AR VR skills. So this is Blue Room. Some of you might know them, some might not. Australian company. We were quite involved in the military area. What they're enabled to do is using VR and augmented reality is actually do training on procedures. So you can be anywhere in the world and you can treat any patient in the world, in any environment in the world, using AR and VR. Brilliant piece of kit. Communications, as I've said, by increasing communication and using health tech to actually increase health communications between clinics, environments, to create that network of upskilling. So I have a low-skill practitioner can suddenly access easily an upskill practitioner in these environments, have a huge impact. Data-driven education. What are we trying to teach people and why? How can we use data to influence pre-training for clinicians? How do you train them on COVID before COVID happens, rather than trying to catch up the other way around? Let's connect our data analytics programs and predictive software within education. And then we can really fundamentally change and make a difference and harness that technology to promote these areas further. The next piece, predictive interventions and processes. I'm an emergency medicine guy, so I'd tip up in a helicopter post-car crash, and I'd try and do all sorts of stuff. It's far easier from my point of view, to stop you getting hit by the bus than have to deal with you after you've been hit by the bus. $1 spent on prevention is worth 100 or 1,000 when it comes to post, because after the event has happened, we have the tiger by the tail. I prefer you not come here. How do you reduce hospital visits? By reducing the amount of people who need to go to hospital. Quite simple as that. So early identification of illness, particularly in low resource environments where it'll take you 3 or 4 days to get there. How do I know 3 days in advance if I need to go to hospital, if my child is actually sick that needs to go? How early can I push that pre-identification? Now, within hospital systems, we're looking at trying to reduce those timelines by a day or a couple of minutes in a high-resource environment. How can we do that, for example, for sepsis in the middle of nowhere? How do I know this patient is deteriorating and needs escalation of care because of my low-resource environments? Pre-treatment of disease. We've spoken a bit about Google's diabetic retinopathy program. Really, really interesting. But imagine taking that further. What if I could pre-treat from birth? So you actually have high genetic risk of cardiovascular disease. Imagine a lifetime of pre-treatment before you actually get to that point. What influence would that have had on health outcomes? How can I pre-treat before we actually start getting those clinical signs of sickness? How early can we push this identification? And how can we push this out into low-resource environments? Prevention. So we've all learned, I think, from COVID, the benefit of increased vaccine development and a rapid vaccine development. However, as someone who's actually run vaccine programs, I can tell you there's still barriers that exist. Cold chain. How do I transport it to these places? What's the lifetime of these things? How do I stop them from breaking? How can we take these areas? Now, I tell you, there's in the low-resource environments, no one's making vaccines. There aren't those factories, not that infrastructure. You're relying on developing an entire logistics program to get them out there. I put in a vaccine program in northern Ethiopia during the war. Absolute real pain to try and get this stuff flowing in and out. Nightmare. How can we actually lift these vaccine programs, miniaturize them, and push them out? How can I make a mini vaccine factory that is able to be created, pushed out to these low-resource environments, and completely tagged and tailored to whatever's coming? I can get ahead of the curve then, reduce logistic footprints impact on it, increase the availability of it to where it needs most. And then finally, blockchain logistics management. Sounds really boring, but it's fundamental. Again, trying to move medications and pharmaceuticals around the world. I think it's very hard to understand how much fraudulent medication exists in this world. I've seen it. I've gone through all the hassle of moving medications and pharmaceuticals across the globe only to find out that they're fake. What's the so what on that? Oh, okay, you lose a bit in it. It's not about that, because the person who takes it loses faith. You have entire populations that don't trust the pharmaceuticals that come from the clinics. How can you build a healthcare system where they don't trust the medications you're trying to get them to save? By use of blockchain, we can actually reduce fraudulent transport of medication, reduce corruption, and more importantly, increase the faith of the actual public we're trying to treat and solve that 98% problem. we can actually allow them to trust when they go to the pharmacy, because the doctor's told them that we've trained on AI to go and get a medication, that the stuff we give them, one, will work and won't do them any harm, because we've actually put it in there. So in summary, often the greatest impacts come from the most basic of interventions, as long as they match the need. So a lot of the stuff we talk about in healthcare infrastructure is great, it's exciting, it's innovative, there's cool photos. But we shouldn't get distracted. We have to also bear in mind that the basic interventions can also have a huge impact on a health population. Healthcare tech can transform the ecosystem by improving access, scalability, and efficiency, and they're core areas that we can utilize. Focus on the 98%. Solve the problem of the most, and that will give you the biggest impact, rather than focusing on trying to solve the problem of the 1%. And you'll make that person very happy, but chances were, on the scale of things, they weren't that bad off anyway. Look at the third or fourth order consequences. Technology innovation is not innovation in its own right. That should not be the purpose of it. We need a pathway to where we're going. That sometimes the innovation itself may lead you, that might not be the solution in its own right, and might be part of that journey. And 3 or 4 consequences down the line, you might find something. And finally, we should all bear in mind, find the potato. Find that bit that will change the world. Find that simple solution that applies to everybody. So when you go back to your offices and you're looking around in ways you put investment, look for the potato. Thank you.
My name is Fatin Nima. I come from a clinical background. I started my career as a nurse back in the United States, and I have over 30 years of healthcare and technology experience, and I've spent about the last 18 years working here in the GCC for the most part. And previously, I've had positions in sales, senior sales positions in Cerner Corporation, which is now Oracle Health. As well, I was the EMEA executive for the Mayo Clinic based here in Dubai. Currently, I'm the CCO, Chief Commercial Officer for Vectramine Corporation, and also the founder of Blue Waters Health, which is a healthcare advisory and consulting company. So it always amazes me how much healthcare is disjointed across the healthcare industry. And from the patient perspective, when you think about all of the different tools that they are currently utilizing, you don't find that in any other industry. And here we have Class Research, which is a company that ranks healthcare technology providers across their capabilities. What they're finding is that in no other industry will you find that you ask a customer to utilize multiple tools or perform multiple functions to complete their task. And so they use the example here of the airline industry where you would not pay for the ticket plus the stewardess plus the on-air services separately. It would all come as a single service. But that's not the case within healthcare. You have your portal that you can go to, you have a mobile app that you can go to, you have something coming at you from an SMS. Nothing is in a single place. Today I'm going to be wearing my CCO hat and talking about a company and the services that they deliver, mostly focusing on the AI within the platform that they've developed. Now, this company first started out as an omni-channel communications company that serviced multiple industries, supporting their customer to support their customers. And what came from that was a learning within the healthcare industry that disjointedness was there. There wasn't a single place where you could find all of the information for your patients. And so that sort of got the wheels turning around what can we do to solve that as a problem. So today, just so that you can understand what is happening across the multiple areas of where organizations are utilizing different companies to achieve something that would enhance the patient experience and give insights. For the most part, you're not going to find a company that does everything, except today here we're going to see what it looks like when a company like VectorMind has attempted this, and what it looks like within the flow. If we are able to achieve this, the stakeholder value is greatly increased. The benefits for the patient, the benefits for the organization, the insurance providers, all of them would benefit from being able to achieve ability to capture the information, be able to analyze it, make corrections in how you deliver care. All of that would present the opportunity to improve the patient outcomes, to enhance the affinity of the patient back to the healthcare organization, making it easy to engage with the healthcare organization. Positive impact on the revenue for the healthcare organization as well, because if you have your patients keep coming back to you, then that means increased revenue. If you're able to eliminate cancellations, reduce the wait times, eliminate no-shows, that all has a positive revenue impact. And while you are doing that, if you're also able to create efficiencies within the operational workflows, it also has the potential for elevating the staff morale. You're making it easier for them to do their jobs. They're able to deliver happy customers, patients, really. So in going down this path of trying to figure out how do we have this impact that we want to achieve, which is basically creating something that I call the power of platform. Everything that we want to do for the patient, focused on the patient, all in a single platform. We first have to realize that we categorize the patient experience in 3 different areas: the pre-visit, the in-journey during visit, and then the activities that happen after a patient has left your organization. And we knew that we wanted to use advanced technologies in order to be able to utilize tools like natural language processing, artificial intelligence to automate many of the things that we wanted to do so that we didn't have to have a huge resource burden placed on the healthcare organization in order to manage these capabilities. So in taking a look at the areas that we have placed the artificial intelligence, for the most part, we looked at the pre-visit communication and education. And for that, the way that we have embedded the artificial intelligence is when a patient has given any kind of feedback, we use natural language processing to identify the sentiments behind what it is that they're trying to tell us. And then based on those sentiments, creating the patient happiness index or the NPS score and so on. But also based on the feedback, identifying what are the areas that we need to focus on with that patient or with our patient population as a whole. Within the during visit phase of the patient journey, creating a smart registration process was important as well. If most of the work that is expected of a patient can be done before they actually arrive at the facility, the time spent at the facility can be reduced. If we can embed rules that state that not all patients have to go to a registration desk, not all patients have to actually, physically present papers, that is time saved for the patient as well. And creating a digital token process where a patient can just go to the department that they are going to be seen in, scan a QR code, have themselves through that process be checked into the clinic, and then just go sit down and wait to be called. That eliminates many steps and reduces the time for the patient. The next thing that we did was we embedded it within the actual process that happens after seeing the physician. So seeing the physician means that, maybe they want to have labs, imaging, ECG, whatever the doctor may order. So creating a process where you don't have patients immediately after seeing the doctor, they all go to lab first, then they go to imaging, then they go to ECG. We created something called adaptive routing. And adaptive routing is something that takes a look at all of the patients that are in waiting and in care and creates a map for the individual patient and tells them where to go next based on the shortest wait times within the departments that they should be visiting. Along the way, we are also capturing within the in-clinic time the wait times, the care times, the transit times. That is being captured and calculated and used to push the patient's flow forward. As well, we are capturing real-time feedback. So we're not waiting for the patient to go home and then be sent a survey. As they complete each service, there's an opportunity to capture feedback, even if it's 2 questions. Did you like your interaction with your doctor? Was your check-in process simple? Whatever question you want to ask. And if there's been a problem in a specific department and you want to capture feedback from patients, you would be able to do that more focused, so depending on what the problem is. And then again, there could be additional surveying that can happen after the patient has gone home. Again, underpinned with NLP to assess what is the sentiment behind the feedback that they are giving. So from the patient perspective, what does that look like? So if we're taking a look at a patient who is on their app, and it could be their app or it can be the organization's app or VectorMind's app, it doesn't matter, we can plug into services as needed. It would be that we can identify when patients have canceled an appointment. Now we have an empty slot as an organization that we need to fill. Let's take that empty slot automatically and push it out to other patients who might want to take it. We can fill slots. Patients who are on waiting lists, the system picks up patients that are on waiting lists and matches them with empty slots and then presents it back to the patient. And what I talked about before about the adaptive routing, having the ability to give the path to the patient, the easiest, most efficient path based on the shortest wait time. It's right there at their fingertips. They don't need to go and ask anyone, where do I go next? What do I do next? What is the shortest path? Now, from the management perspective, how do we manage the experience? Well, as the patient is going through their journey, if there is negative feedback that is received, then that would go through an escalation process, utilizing AI to escalate experiences up to, for example, the head of patient experience is a capability that we felt was important. And then to be able to drill into the data and take action based on that information was also important. So in this case, drilling into the different departments, red means that the area has exceeded the KPI set for that department in terms of wait time. And if we find the patient, then we can give them a higher priority and serve them much sooner. We could also give them a higher priority for the rest of their journey. So AI in action at the patient level while they are still with us and not after they've gone home. The other thing we've done is we've been able to capture transit times. How long does it take for a patient to get from the doctor area to the lab or pharmacy? And how far in advance will we know so that we can take action? Well, we know that we've got a number of patients and we can see that the path, according to historical information that the system knows, is that from a specific department, patients typically go from there to the lab and then from the lab to pharmacy. And so if you can only imagine that in the morning, pharmacy can take a look at this and say, you know what, it looks like we're going to have 100 patients coming at us in the next hour. Are we ready for this? Do we need to open up another counter? This is going to help reduce the number of patients that are going to be waiting in the pharmacy area. And then also being able to drill into a specific patient's experience, capturing all of that information and putting it in the face of somebody who is going to be taking a complaint, for example, understanding what was their journey, how long were they waiting for registration? How long were they in care? How long did it take them to get from one hop of their journey to the next? Capturing how many notifications did we send the patient? How many appointment reminders? What was the mechanism we did that? Where did they check in? On a kiosk, on their phone? All of that information is captured and presented to anyone who is going to be servicing that patient if there is a negative complaint. As well, at the individual patient level, we capture the patient happiness index. So all of that information is being calculated into what that outcome is for that patient, and then how does it relate to the last experience that they had with us. So what does it look like when we are trying to improve the experience? So dashboard views of the data that has been captured just from the patient journey. The sentiments that I talked about from the feedback the patient has been given can be analyzed. And then you can understand what are the patients saying about us? What are the different areas of improvement that we can make? Do they feel like we're empathetic enough as an organization? Capturing your NPS score at the department level. And then your organizational happiness index, not just at the patient level. And then also tracking yesterday to today or previous to today. And these are just some of the areas that, that we look at from analytics that can be utilized to improve patient experience. From the information that we are capturing from the patient, we are also able to identify patient-reported experience measures and identifying where we are doing well, where we are not. The important thing here is that not only are we able to look at the data, but because everything is on the single platform, we're able to correlate that data. So we can then correlate a bad experience with what was happening operationally at that moment in time. What was the bad experience related to high wait times in a specific department? Was it related to something else? So being able to correlate the data and show how the experience, what was the context around that experience is very important. And then finally, the ability to predict the future utilizing this data. We know utilizing AI, we could take a look at the historical experience data points and then be able to predict what the future will look like for that patient as well as for the department as well. And so in this case here, we're taking a look at identifying what is going to be happening in terms of numbers of appointments, numbers of check-ins, numbers of no-shows, early arrivals, late arrivals. By the way, early arrivals, there is a situation in the Middle East where we find that patients travel long distances, arrive early, and then they are sitting in the waiting room for a long time. So that could be one of the contributing factors. But here, identifying that in dermatology, we're going to have 13 no-shows. We could see this ahead of time. We could look 3 days to a week in advance, even longer, and make these predictions. So what actions are we going to take to try and eliminate those? And so that could be increased communication with the patient, more reminders, more confirmations, a phone call. Actions can be taken. As well, we're able to predict the count of patients that will be within that specific department that we're looking at, as well as care loads within specific departments, including ancillaries. And so taking a look at what is going to be the predicted care load by clinic, by pharmacy, by lab, radiology, any of the departments that can be captured and displayed. So the most important thing for many healthcare organizations, it's nice and wonderful to have all of that data, but how does that tie back to the revenue? So we're able to take a look at the data points and then tie it back to how much did no-shows cost us this day, this week, this month? How much did cancellations cost us? This is the evidence that operations would need in order to help budget for introducing new programs that would be helping to solve those problems. And that's my presentation.
Thank you for all of you. I want to start with Nick, if I may, with the example of potatoes. That was very, very interesting. I wanted to ask you about perhaps something similar maybe that happened in the 70s with the contraceptives, the introduction of contraceptives. And a lot of studies show that with the introduction of that, that allowed more family planning, more women to go out there and work, etc. What are your thoughts on that?
100%. So again, it's falling to that same concept of what is the big problem? What is the 98%, in this case, the whatever 51% problem that everybody is having, and how can we go to solve it? And although on the outside of it, like clinically, it's a demonstration of high technology, the amount of understanding of the hormones and the pharmacology and all of that stuff comes up to the point where it's actually quite a simple solution. So again, it's that third or fourth order consequence in which by harnessing technology gets you to a point, you can implement something very simple, and then the benefits are wide ranging across the way, broadly, again, even outside of what the initial purpose was. So in that point, it was the ability to go to work, harnessing extra workforce and tax and better family life and family planning. So I completely agree. It falls into the same category. And this is what I say about history, is that we can see these events through history and they all fall into the same sort of criteria.
Amr, if I look at the impact of technology on hospitals as we know it, how do people who run hospitals like yourselves look at it? Is it more of an enabling factor, or do you actually see it as a threat?
I think looking at the whole ecosystem, there of course you have the hospital, you have the administration, physician, patients, staff, and then of course we can never forget the insurance companies and regulators. So the regulation plays a big major factor, because even though we identify that if we add this piece of technology, it'll enhance the outcome and streamline the patient journey and give us a better reputation in terms of efficacy. If the regulator does not pay us, which is we call CPT codes, or reimburse us for this, then it never sees daylight, because it's a balance. And if we don't get paid for it, we cannot basically fund it free of charge. Some cash-paying patients are willing to go that route. And as a matter of fact, when I mentioned histotripsy, I put a post on LinkedIn and I got approached by somebody in Singapore saying, my mom has liver cancer, stage 2. Does your American hospital have it? And I said, unfortunately not, but it's work in progress. So in totality, I think we all need to create a balance. Us as hospitals and hospital administrators, we need to basically communicate with the regulatory bodies. That's DHA, MOH, and SIHA, and of course the insurance providers to create the CPT code and to pay us for such services, because it's the future. Thank you.
Right. So, for example, if I'm a patient and I go see a doctor and I need to do a follow-up, and that follow-up can be done remotely. Now, you would support it if the remote follow-up is paid for, and you won't support it if it's not paid for?
Well,
I'm just putting you on the spot.
Yes. So, two issues here, two challenges with telehealth or remote health, and COVID exposed us. COVID took our jackets off.
Right.
So telehealth is very beneficial to the health industry, extremely beneficial, especially for some indications like dermatology. Hello, doctor, I have a rash. He says, show me your hand against the camera, and you say here. And he goes, oh, you have eczema, and he prescribes a cream. And then your problem is over. The problem is, again, the regulators and the insurance companies. If it's telehealth, they pay you 100 dirhams. Although you have to log in as a patient, put your credit card, put all your information, and then you have to book this doctor who sits across the computer. He has to be there for you. And then the doctor has to do charting and report and share it with you. All of that for 100 dirhams. So this is the challenge again.
Right.
Yeah.
No, of course. I hear you. Fatin, if we look at, now you're the the queen of revenue management, and that's very important for hospitals. And as you know, usually hospitals spend millions and billions of dollars in the setup, and all of that. And it's not cheap, to say the least. So how do you balance between using technology to increase the bottom line or the top line versus optimization and rationalization?
I believe that the way that you do that is by having the right data that is necessary in order to make those decisions. Without having comprehensive data and having insights into how we arrived at that data, putting measures in place that would only be a stopgap may end up costing you a lot more in the long run. So that's a consideration to make. So one of the things that I think of is within every other industry, customer service is something that's very important. And if you think about even e-commerce, companies know so much about the things that we are buying, how we are buying, when we are buying. If we abandon a cart online, they email us. They know exactly what our buying persona is, and they know how to target it. But within healthcare, we don't have that kind of insight for the patient itself. We don't know the patient behaviors, or until now, there hasn't been anything that enables us to have those kind of insights about the patients. But when you have a platform that includes a CRM as well as the whole patient experience being captured, having that data would then be able to allow you to make those kind of decisions. Do I need to fix a bottleneck at the moment, or do I need to make a long-term investment into solving my problems?
Nick, I'll go back to you with a final question. The things that you guys are doing at Smart Salem are great in terms of prevention, and I think the future of healthcare is taking prevention outside of the walls of the hospital. If you're not sick and you want to look at prevention, you don't really want to go to a hospital. You want to go to a Smart Salem and get yourself checked up and look at various things, whether it's food allergies, lifestyle, etc. So this is all great, and amazing. I think it will even develop further. But my question is, how do you then integrate and not become a silo versus the entire health system? So it's great to know what your food allergies are, your cancer biomarkers, etc. But then how about your family doctor? How do you then share that information in a way that you help the family doctor?
Yeah, for sure. And it's something that we've always focused on, is we don't see sick people necessarily. They come to us healthy and end up sick. And it's a lot of it, we view ourselves as being the canary in the mine. So you come to us and you're not sick. I don't believe in having to wait. It's a very old-fashioned approach to medicine, I think, is waiting until something has got so bad, there is clinical symptoms you don't want to deal with, you can't maintain it, then you seek help. I think that's crazy. So it's the ability to actually make low-hanging fruit, reduce the barriers to having early preventative checkups. And then we refer. So we give you that information. We give that information in a clinical fashion, so you will always see a doctor's consultation. And then that can be passed on to your treating physician that has the broader history. So we don't hold patients necessarily in Smart Salem. What we do is we find out, they come to us to reduce the barriers, and then we pass them back either to their treating physicians or refer them onwards to where they can best get the help they need if there isn't one. So I think it is that close relationship, and I think that's part of that broader ecosystem, much like a hub and spoke, where people can actually approach other facilities because it's more convenient, and then centralize that place of medical information and medical knowledge on their complete history back with their treating physician, which I still there is a huge place for within modern healthcare.
Great, excellent. So there is someone on your left who's sitting next to you, might be a potential partner, I guess.
Nodding, yes.
Great. Well, on that note, I just want to thank all of the speakers for your contribution. This was very, very interesting and useful, and I hope the rest of you enjoyed it. Thank you very much.
Thank you.
Thank you.